Hi everyone, I am Dr. Hanjabam Barun Sharma. I am from Indian Society of Sports and Exercise Medicine. Today we have a very special guest. Uh, she is very well-known figure in the field of the fitness and bodybuilding as well. She is also a doctor, and she is Dr. Maya Rathod, and she has done her MBBS and DGO, that is IVF specialist, obstetrician and gynecologist, and also a laparoscopic surgeon. And she is an international bodybuilder, Australian figure championship gold medalist, also Miss Maharashtra, also silver medalist, as well as Miss Mumbai silver medalist, and also Taekwondo and kickboxing black belt. So we have both the brain and the body type of the figure, and she is well known in the field of the fitness as well as entertainment also. So I welcome you, madam, from Indian Society of Sports and Exercise Medicine, and the
Thank
stage
you
is
so much.
yours. The stage is yours.
My pleasure to be with you all and share about my journey. So thank you so much for sharing this platform with me.
So, ma'am, please tell me about yourself a little bit, because I've already introduced you. But the thing is, everyone wants to hear from you. I mean, how you started everything, your career from your undergraduate, from before that schooling also, everything. So please tell something about yourself.
It's very interesting because I am being born and brought up in Dadasaheb Phalke Chitra Nagari, a place where all the shooting happens. So normally everybody had a perception that we might land up into Bollywood uh, uh, but then we all, brother and sisters, we went into field of being doctors. And then I was good in sports from before and I always wanted to be in sports. So after college, I did my taekwondo kickboxing in my school times. And then I was very good in sports in college times. I won a lot of medals and then was the best athlete of the years. And but after marriage, I stopped being into sports activity because there was a lot of responsibility, career-wise as well as family-wise. And then after a certain period, I decided that I always used to think that I'm losing somewhere myself, like what I used to be and what I am right now because of the responsibilities burdened up on my shoulders. So I decided to find myself back into the sports activity. And that's how I went to a journey of reducing weight. And bodybuilding just happened because of the circumstances and friends all around and the attraction towards it over the period of time. And that's how I turned up my shell towards it. I can't hear your voice. I'm sorry. You need to unmute yourself.
So, madam, I mean, out of all the physical activity and sports, how do you choose bodybuilding? Because being a female, in India itself, bodybuilding is a little bit, uncommon sports for the females, especially after
Yes,
marriage.
that was the reason why I selected it because there were very few in it. And my friends used to do a bodybuilding. They were professional bodybuilders, one of my friends. And I used to accompany them with their competition preps and everything. So I used to see that there are very few number of girls in that platform. And I always was curious to why it is such a beautiful sport. It needs so much of patience, you need so much of hard work, you need so much of dedication in that, and it is still unsung by a lot of Indians here for a female. And that's how I decided, like, if we get into it, then we might motivate more of the women to come ahead. And that's how I selected that sports because they were not more in numbers, and that's how I went towards it.
Very nice, ma'am. So, madam, because after marriage, you said that a lot of responsibility is also there. It has to be naturally, it has to be there. So, how come? I mean, how you balance your, because you are also a professional doctor. I mean, a gynecologist is such a busy job. As a clinician job. So, how do you manage with your career, your education part, your family life, as well as your training? I mean, how do you manage all these things?
The only key factor towards it's my time management, which I do. Because see, bodybuilding is more of dedication towards what you eat and the lifestyle you accept. And 2 to 3 hours a day you have to keep your into the gym. So for me, I don't disturb my daily routine of being a doctor and being a mother and being a family person. What I do is when people are sleeping, when my family members are sleeping, I go to the gym. That's the time when I take out a time and I prepare my meals and then I carry them all the way. And that is how I think I manage all the three phases of being a family person, being a doctor, and being an athlete. So time management is the only thing which I carry in myself. If I have to go to the hospital at 8 o'clock or 9 o'clock in the morning, then I get up at 6 o'clock or maybe 5 o'clock in the morning and I finish my session where I don't disturb my routine. Like when I was preparing for my comp prep in Australia, I used to get up at around 3:30, 4 o'clock in the morning to complete my sessions. So there are certain times of phase when you have to be, get up in midnight and do your sessions.
Oh, wow. Excellent. And that's extreme dedication, ma'am. So, ma'am, I mean, starting just as an amateur, because everyone has to start as amateur. So, when do you decide that you have to go into this professional stuff? I mean, when the transition happened and what triggered you, to take up this bodybuilding sports, lifestyle
Yes.
as a professional, as a serious stuff?
Yes, initially as a like other Indian women, major of the Indian women, after marriage also I had put on a lot of weight
Okay, okay,
and I was practicing in Mumbai.
okay,
But then my weight was so much, like around 78 kg, and I
okay.
was not able to do my routine work as enthusiastically I used to do. And
Okay.
somewhere in between of being at present and being in past, I always used to thought that this is not me. I am not. I'm easily getting fatigued. I am not able to be myself. I'm not that confident as I was previously. And that was the moment when I thought, like, I have to get back where I was. I can't be lazy person. I can't be a procrastinated person. I have to be super active as I was in my college days, in my school days. That was the moment where I decided, and I told my family members that I want to get into back into shape. And then initially everybody was like, now you're a doctor, you're a mother, why you need to get into shape and everything, like as an Indian tendency that what you need to
Absolutely,
do it
absolutely.
now. You need to just focus on your career now. You need to focus on upbringing of your kids. And but that thing did not let me down in deciding that I have to get back to what I was and what is my actual identity. That Dr. Maya is a super active woman, and that's how I decided to be back.
Excellent, excellent. That means fitness is the, being to be fit is the one of the reason for you to join this sport, right, ma'am?
Yes, being a
So,
doctor as a gynecologist, I know women don't come forward when it comes to their own health. They can take care of their husband, they can take care of their kids, but when it
absolutely.
comes to them, they are overloaded with the household works and they neglect their health a lot. And that is
Absolutely.
very important. That's, I mean, she is the main person to take care of everyone, other family member. And if she is not healthy, she won't be able to concentrate and focus on others' health.
Absolutely, absolutely.
Yeah, because when I practice, I see all the shades of women from being look, I come over all the sort of problems which the patient shares with me, and always major of the problem is always about the health of a woman. She always neglect her health or when it comes on giving priority about family, husbands, kids, and everything, and even their career. So I think that is very important to remember that a woman has to be healthy to keep a family healthy.
Absolutely, absolutely, ma'am. Absolutely. So, ma'am, after joining this sports, after being, in this journey, I mean, how do you find yourself as a different? I mean, if you have not taken this job as just as a practicing, a clinician as well as a housewife, dedicated housewife, and now being you are a fitness icon and doing all this stuff. So, how do you see yourself? I mean, कितना different आपको ये लगा? What
See,
are the advantages you feel?
nothing has changed. Only the responsibility of inspiring other people has increased. Initially, my dream and my passion was up to me. Now it is looked upon by the world, and it's looked about by a lot of women in India. In India. So initially, nothing other than my responsibilities, nothing other than my work. Only a thing which has changed is to my responsibility as an add-on is to I have to inspire other women about talking about the health, making them understand what health is actually. Up till now, I was only a surgeon where you come to me as a patient and I talk to you and you go. But now what happens is like, when you are on social media, when you are personally talking, you're going to any conferences, you are in public, people do expect you to give a healthy tip. People do expect you to motivate them so that they can follow the same path. And that's all it has increased now, that's the only thing changes I find. Otherwise, the rest of my kids are growing in the same pattern, my patients are flowing in the same pattern, I do the surgery in the same pattern, and I'm still dedicated to my gym as same way. So nothing is changed in that sense.
Okay, very, very nice. So how do you respond to, to nowadays people are saying we don't have time for gym and all this? How do you respond? ये सब लोग बोलते हैं कि we want to start but the time नहीं है and all this.
I know. That's procrastination is a tip of time. That's always I try to make people understand that today you don't have time to gym, but then tomorrow you have to waste a lot of money in coming to hospital for your unhealthy things. So right now it is better other than giving a hole to your pockets. It's better to you take out time. That's more profitable to give time.
Absolutely, long term, goal. Long term goal is more important. So, madam, how do you find, this Indian? Because you must be knowing all the doctors are, they have to know all regarding fitness and all that stuff. But the problem, what we see in day-to-day activities is doctors are more good in theory. I mean, more theory you have to, but they themselves doesn't do all these things. So, I mean, what do you want to give tips to all the, medical practitioner who are supposed to be, expert of the health as well as, I mean, the acute treatment part as well as the chronic part, the lifestyle part. So how do you, I mean, want to, express your this thing to motivate other to tell them how they have to, go, I mean, from the theoretical part to more into practical part, they have to themselves follow all these things. What do you want to say to them?
I'm not that big enough to give a suggestion, but then yes, as a person, I would like to tell, like, I think we need to talk about the stress factor. Now, what happens nowadays when you go to a hospital or when you meet a doctor, the first thing you are gifted is the stress. Okay, you got this. This is something serious. Okay, you have this problem. This is something serious. And this goes vice versa. If you don't tell a patient that things are serious, they don't consider it. And if you tell them that the things are serious, they get stressed about it. So, only thing is, who all audience are watching me right now, or maybe in future they watch this audio. I'll only tell that is, uh, uh, give your own thoughts about what you take a decisions about your lifestyle, your disease or your problems. Because what happens is you go to a doctor and he gives you a single opinion. You go to YouTube, you get 100 opinions. Now you have to be a sensible person to understand what is right and what is wrong. Because normally what happens is there are a lot of YouTube videos made by immature people who even don't understand what is that. There are a lot of fitness trainers who are not even certified and they talk so many things about their health, lifestyle and everything. So what I think, mostly we are in an era where everybody is educated, everybody is on social media. Only thing I would like to say is like sensibly you have to make a choice, like what is right and what is wrong, you know because when you come to a doctor, you talk about a problem, you're discussing to a person, only a single person. You never know that you might get a second opinion of a doctor who is sitting next door, might make you understand in the better way. So that's all I think, because if I tell that I will advise something about to that what fitness doctor has to follow, then it is a very vague answer to give. Because other than improvising all the 100 of doctors, we should take an attempt to improvise our knowledge.
Absolutely. Very nice, ma'am. So improvement, I mean, improvement of the self is more important so that we can change the later on everyone. So now, ma'am, I mean, you being a fitness icon, so and also a doctor. So when you do your treatment of your patient, how do you incorporate your fitness knowledge into their treatment? Like, for example,
Can you be little bit, doctor, loud, because I'm really getting a very low sound from you.
Okay. Can you hear me, ma'am?
Yes.
Yes. So you being a fitness expert as well as a medical doctor, practicing medical doctor, and you must be seeing lots of female, with overweight, obese and all that stuff coming to you. So how do you incorporate your clinical practice with your fitness tips? I mean, regarding say weight loss or regarding PCOS, like say. So how do you incorporate component of the lifestyle as well as fitness into your clinical practice?
Yeah, I do get every day. I mean, like, I have to be with them every day. What I do is, like, I don't force them to do this, do that. I just simply explain them the things that how their lifestyle can change their entire world of being healthy, being kind of into, and being more focusing on your life. Because like, I get a lot of problems of PCOD, thyroid, diabetes, hypertensions, and no wonder such a young girls are getting affected by so many things. So I don't tell them that go and do a diet from today. You don't eat this, don't eat that, and because that is not feasible for a person who is not an athlete. If you tell me to eat a bland food, if you tell me to incorporate that, from tomorrow I'm not supposed to eat anything, I can accept it because I have accepted it in my life that I'm an athlete and I want to be an athlete. But if a common person comes to me and I tell them that from today you're not going to have sugar, milk, you're not going to have oil, or he will just block me, saying that, okay, she is not a word to talk. Because that's what we are. We are made to eat, we are made to live. Now, what generally I do, I don't say that be on strict diet, but then what I tell them, what I suggest normally in my OPD is that to change their lifestyle and change little things. Like, if you're having a carb, you stop having it after 6 o'clock in the evening. If you're having a oil, instead of using oil in your cooking, you can use the oil spray of olive oil, or you can just spray the oil instead of using the teaspoon or two tablespoon or 3 tablespoon of oil. That can really change a lot of things, because that is not only one time when you will spray oil in your vegetables. If you continue and calculatively understand that if you're spraying your oil for every day, the amount of oil you consume by the end of a month reduces a lot. I suggest them not to be tea or coffee which they have at sugar. You can have a sugar free. I always suggest them that you just need a sweetness, you can just replace it with the sugar. Just stop eating after, and whenever you feel hungry, instead of having chips, having biscuits or anything, you can have dry fruits, you can have vegetables. These are the simple things. And normally what happens, doctor, that if you inculcate this lifestyle, your kids, upgrowing kids, also inculcate this.
Absolutely.
So only thing is, and it's no worry that you can have your pizza, burger, but then you need to have a span of it before having it. You can have it after 15 days, you can have it after a week or so as a treat of to your life. But then, yeah, it is compulsory to have your healthy food in those span, because you might get the taste for a temporary day, like, you get a pizza every day, you eat a burger every day, you might get a taste of your life, but eventually you're going to land up in a lot of problems, complications, and that we have to be sensibly understanding and accepting it.
That's beautiful, ma'am. I mean, the advice has to be practical, more practical oriented, as well as small step, small step with achievable goals, so that if we drastically do something, then the patient obviously will not accept. So
Yes,
it has to
and
be
I
practical.
do tell them that when you're on a, you nowadays, most of the people of us are on social medias. We keep on browsing the mobiles and all that. I just tell them that instead of sitting home, just wear your chappal and just keep a walk on the road, and just keep on browsing whatever you want to browse. Just go in the garden, browse it. do whatever you want to take. Just take half an hour, put the headphone, listen your best music, and that's how you can just utilize that time.
Absolutely, absolutely, ma'am. So, ma'am, you have spoken regarding lots of social media, lots of YouTube trainer who are not so trained. I mean, in India also. So, what do you want to say regarding the local gym and their usual practice in here India, and as compared to where you have practiced there? So, do you want to see any kind of improvement since then and now, or
It's a complete
you want
different
to
world.
different type of trainers? So lots of differences there between say Australia, their scenario, and here in India. So how do you find the difference
It's a
regarding the
complete
fitness?
different scenario because trainers there, you get certified only after you do a training course of 3 years. Where they, I have done Australian Fitness Academy course where I have
Oh,
myself done it.
excellent,
I took
excellent.
it because there was a lockdown and I had nothing much to do and I wanted to utilize my time. And that time frame I took it to understand that how the bodybuilding happens in India and how the bodybuilding happens internationally, and that's how I got enrolled into their course. And I studied my anatomy again. I studied the
Very good, very
physiology
good.
of the muscles again. So these the trainers over there have the depth of knowledge like a doctor, because it's a 3 years course where they you bombard you
Absolutely.
with every little thing where you don't harm any of your client.
Mm-hmm.
In India, it is when you go to a periphery. Of course, when you go into the center and boom of in country, metro cities and all that, you get very good trainers who are extra knowledgeable, who are tremendously with their knowledge and experiences. They make beautiful, give their beautiful trainings and efforts. But then when you go to a periphery region where you have a very local gyms, you really have those kinds of trainer who pretends to be a trainer and gives all the false knowledge to the people, and the people who follow them takes the wrong information, and that's something where I feel bad about it, that they are being misguided by some of the people who really don't have the knowledge about it. Because
Absolutely.
the trainer gets its paid. Of course, the trainer has to survive. He has his own life, family to take care of it. But on other hand, you cannot make your family happy by giving wrong guides and wrong techniques to other people, because you might injure him, you might
Absolutely.
let him into some kind of injuries or some kind of health issues and all that, which is not done. Like when
True.
I'm not talking only on the aspect of training, on the aspects of um, performance enhancing drugs which they take. Of course,
Mhm.
you are somewhere you are what you can say is like you're making the young generation demanding of it. You have,
Absolutely.
even on my Facebook and Insta, I get 18 years, 20 years kids asking for what are drug enhancing performance. These are not your age to even understand about them, and
Absolutely.
that is what they
Absolutely.
are misguiding it.
Absolutely.
I
Absolutely.
personally met a woman who was in on steroids, and all of a sudden I got a call when I was in Mumbai saying that there is a rupture in the liver, and we have a patient. She is into this, and I had to rush to the hospital taking care of it. And I said, like, you cannot use these. You're too young for all these things, and this is how they are guided and misguided. This is just one story. There are hundred of stories if you come to across, but this is my own personal experience of things happening, and that what makes me little bit bitter towards understanding this local gym and training how happens in India.
That's right. That's right. Knowledge is extremely important, but unfortunately, India doesn't have any systemic program. But now the situation
But
is changing.
I must say there are many athletes, many trainers in India who have taken initiative to give knowledge through social
Absolutely.
medias, and they are
Absolutely.
making people aware of it, what it is, and
Mhm.
all that. And recently, I would like to share the experience. Recently, I met Akshay Kolarkar. I was talking to him on phone, and he's also a professional power lifter and a bodybuilder as well. And I was talking, having a conversation, and he was like, there is a guy who is just 24 and asking for drug enhances drug, and how can they talk about this? He was very negative about it, and that gave me a positive approach. Ke we have these kinds of trainer who are against all these things, who doesn't want young generation to get damaged. And that makes you happy, at least on that part, okay, we are not sharing much of wrong knowledge.
So, madam, in your opinion, what should be done? I mean, what should be done to improve all this situation in India?
See, India is such a populated country and everybody is surviving on their own expenses, and we are still developing, we are still not developed. So if we put, you and me or many XYZ person puts a system that this is supposed to be a protocol and this is supposed to be followed, but then every uneducated person and every underprivileged person will not able to follow that, and he will struggle for his own life. So me telling that this system should be inculcated will really not help much until unless we increase the literacy rate, until unless we grow more towards developing. So this will be the scenario when we can expect a change from all this thing, you know.
That's right. That's right. Absolutely. So, madam, unfortunately, you have been hearing lots of unfortunate death. Have been, I mean, we have been hearing all from different social media, previous, the bodybuilders also, or the gym goers also, regular gym, sudden cardiac death and all this stuff. So, how do you see? I mean, is there any increase, or is just we are just hearing because of the, more highlight in the news or media, or it just is there is any link between, PED, performance in drugs, or wrong, wrong information, wrong training, or I mean, what do you see all this thing, all this unfortunate, incidents?
See, normally, initially, we never used to hear about heart fail. Hardly once in a blue moon, we used to hear that somebody is dead because of heart fail and all that. Normal, ordinary people are also dying of heart fail. It is not only the bodybuilders dying of heart fail. Now, what is happening, to be very frank, we are into a social media phase nowadays. Initially, when a bodybuilder used to, finish his competition by taking the drug enhancing performance, he used to be off season, and then he used to eat, detox his body, come back to his normal life, give his system a break by every stress which he had given, he or she had given to the body at the time of competition. Now, what is happening? Once you become a fame, or once you become a brand, and once you become a name, you have that pressure to continue that. You have a photo shoots, you have a social media post,
Absolutely.
and you have to keep on posting, you have to keep on show offing your own body again and again. And then how that happens is, physiologically, it is not possible until and unless you take a drug enhancing
Absolutely.
medicines. And of course, there are natural bodybuilders as well, but very few, to be very frank. I'm not saying there
Absolutely.
are not, they
Absolutely.
are, but they are very few. Now, competition has increased. People wants to compete each other. Okay,
Absolutely.
what are we in an era? Acha, one person has posted this, let me also post. Okay, he has posted such a nice thing, let me also post. This has become, this is what we are into era of now. We are not into era of thinking good and bad. We are in an era of competing, like how I can be best than other.
Absolutely. Absolutely. That's right, man.
So in that way, what is happening? They keep on taking the all kind of supplements. They keep on trying to boost of themselves, etc. And this is affecting them ultimately, because when you take drug enhancing performance tablets, when you take injections, when you take all kind of supplements, glutamine is good for your body, creatinine is good for your body, protein shakes are good for your body, but at a limit. Everything excess is a poison to your body. So now what happens is, in looking good, in getting competitions, in becoming a brand, you forget the ill effect of that, and you are being pressurized to take it, so that you maintain yourself in as an athlete. So that is why it is affecting now, because we see the external thing. We don't see the internal thing, how the body is reacting to it. We don't see
Absolutely.
what our heart is going through. We don't see what our lungs are going through. We don't see what our intestines are going through, because that's not visible. So we don't even want to see that what is
That's
happening to our body inside. And when all of a sudden you are unwell, then you understand the consequences that what you have done to your body.
Absolutely, absolutely, ma'am. I mean, fitness has to be not only the physics, not only the external beauty, but also the internally one has to be fit regarding
Exactly.
all this.
What I always suggest to people whom I meet in Australia when I
Mm-hmm.
have a meet when I get a professional athlete from Sydney
Mm-hmm.
in my hospital, I always tell them, you compete, you are an athlete, you will compete. But I just a person, I always tell them that you need a break to your body. You
Mm-hmm.
know, even if you put on running a machine, it
Mm-hmm.
gives off at a time. So that's the similar way. If you are on a competition, you are on strict diet, you're not eating your carb, you're not
Mm-hmm.
eating your fat, you're completely
Mm-hmm.
shredded. Give
Mm-hmm.
a break to your body and be
Absolute,
as a
absolute.
natural human being, eat everything, be a stress reliever. But now
Mm-hmm.
what is happening, as I said earlier, we are in a competitive world. So people don't want to
Mm-hmm.
lose that. I know
Mm-hmm.
if a woman has six abs,
Mm-hmm.
she doesn't
Mm-hmm.
want to lose them. And she struggles for
Absolutely,
that. She
absolutely
struggles
right.
for that. She says that
Mm-hmm.
if I lose this, I might lose my brand, I might lose my
Mm-hmm.
followers, I might lose my identity, what I am as a
Mm-hmm.
fitness trainer. And that is
Mm-hmm.
what's happening. So
That's right.
I believe that you should be a couple of months away from your photo shoots, couple of months away from social media, couple of months away from your this, and give a break to your body where you detoxify your body and make it ready for another competition where you can stress out your body again.
That's right. So, I mean, what is your comment regarding the people who are claiming the natural bodybuilding? I mean, some people are claiming that they are doing natural bodybuilding. So,
Yeah,
I don't
natural
think.
bodybuilding can
Uh,
happen here. It is
mhm.
not. It is not a myth that natural bodybuilding doesn't happen. Yes, that natural body. Only
Absolute,
side
absolute,
effect of natural bodybuilding is it takes longer time, and nobody wants to
Mhm.
give time.
Absolutely, absolutely.
Everybody wants instant
A
results.
shortcut. Yeah. That's right. That's right. Shortcut. Everyone wants. So,
Yeah.
what is your comment regarding the vegan movement and vegan bodybuilding? Because some of the bodybuilders they want to be they want to avoid the animal fat also because protein, as you have said, is extremely important. So,
Yes, we
what is
have
your
vegan
advice regarding
bodybuilders.
that?
They
Mm-hmm.
that's see. It's about how you choose your life. Like as I said, it's a healthy wise. Have your own perceptions. If you are happy with dairy product, you enjoy your muscles from them. If you are happy with meat, you can have your muscles and fitness from them. If you don't want them, then you can go to organic or being a vegan. Yes, we have. I know some of the vegans who are in Sydney. They are vegans bodybuilder. They
Mm-hmm.
beautifully manage their fitness. So it's
Mm-hmm.
not that, you cannot be a vegan bodybuilder. Yes, you can. You can build your body and be a fit on vegan diet as well.
Okay, very nice. So, madam, I mean, let's talk a little bit detail about your training. I mean, what type of training you do, breaking down into different component. So, normally what you do. So, you can share with your, I mean, with us also, with the audience also, how do you train, how many frequency, reps and all this, how do you take about whole body or either is a upper or, back or like that. I mean, broken down into different body segment like that. So, little bit detail will be
Okay.
appreciated.
To
Uh,
be frank, being a doctor is an advantage to me because I
mhm,
know my body very well and I know
mhm,
the physiology of when my body is going to react how. So
mhm,
for me, what I do is after a competition, I take a break and I
okay.
eat everything. I am out of stress of being an athlete.
Mhm,
I'm not fond of having photo shoots. I'm not having
mhm,
fond of having my bikini body, or I'm not fond of anything. I
mhm,
come to be a natural doctor. I just
mhm,
detox my body.
mhm,
After a couple of months, I'm back to a gaining phase where I
mhm,
gain the size, lean
mhm,
size. Like
mhm.
right now, I am about to start my lean gain. So
Okay.
in that, what I do is I have a progressive workload.
Mhm,
Like I will be every week weights we increase every week.
mhm,
Progressively we start increasing the weight,
mhm,
and we do a compound movements more when we are gaining.
mhm, mhm,
And in that, what we do is we have carb in a good
mhm,
proportion.
mhm,
I'll do that gaining for a couple of months till my desired achievable weight has been achieved. Once I
absolutely.
achieve that, then I go for a
Mhm,
shredding where I lose my carb and
mhm,
I do lot of kind of I inculcate my cardio in that. In cardio, I never recommended you doing cycling, you doing running, you doing ellipticals. That doesn't make much of difference. Though machine calories are just awake calories, to be very frank.
Absolutely.
Whoever tells me that why did you comment about machines like this, I am a very ethical person, and being a doctor, I don't support these kinds of machines, because you're moving and your momentum, once it catches, you keep moving with your momentum, and after 1 hour you feel that, oh, I have burned so much of calorie, which actually is not the truth. I
Absolutely.
believe in doing fit cardios. I believe in running on the road instead of on the walker. And second, then my repetition increases when I'm in the lean. And I do morning cardio, and then I do night workout training. And that's in my schedule what I do. Now, to add into this, when I'm talking about both gaining and shedding part, most of the people ask me that how much reps should one do that.
That's
Now
right.
let
That's
me add to this. Now what happens is there is a difference between being a bodybuilder and being a power lifter.
right. Absolutely.
Now
Absolutely.
I have seen many videos where people take huge weights and they just go out of their ego and take the weights. But that is ultimately not giving you a bodybuilding. That is giving you a strength training, where you say, and that a power
Absolutely.
lifter needs a strength training. So when I see you guys in the gym, taking four plates instead, which is out of their strength, and then they pull the weight and say, like, look at my muscles, they are growing so good. It doesn't happen, because there is a physiological hypertrophy doesn't happen with it. Hypertrophy happens when you take a minimal moderate weight and you give normally 8 to 12 reps. That should be your set when you want a high size of your body.
That's right. That's
And your last set should be like, without support, you take 3 to 4 reps at the max, and you can't pull more than that. That's the time when your body gets into physiology of hypertrophy. Now normally what happens, like, a guy comes, a girl comes taking a lot of weight, and then they go home with a placebo effect of, okay, I did so much of heavy weight today, now my muscles will grow. That doesn't happen, because you're giving strength training to your body. You did not do anything which will help it to go into a hypertrophy.
That's right. That's right.
So when you want a size of a muscle, go for 8 to 12 reps with progressive overload and moderate weight.
Very nice.
So
Very nice.
that's very important.
Absolutely. And that the rep, the last rep has to be taken to the failure, right, ma'am? I mean, to failure, it will causes more this thing.
Exactly.
So it should be moderate weight, and the repetition should not be too small also, because it will be goes into different type of this thing, because we have to focus more on the hypertrophy, right?
Yeah.
Absolutely right.
And resting in between sets, I would like to include in that. There are
Absolutely.
big muscles, like when there is back, when there is leg, when that's chest, which is also included in your big muscles. You need to take a rest of 1 minute, so that you give a fresh shot on your next split. If you
1 minute
give
rest.
very little duration, you become fatigued. When you take too much of it, you are giving a lot of time for recovery of your muscles, and then you start from zero again. So 1 minute, when it comes to your short muscles like your shoulders, your biceps, your triceps, this needs only 30 to 40 seconds of a break. Not even 30 seconds is enough for a muscle to take a break. So when
That's
you
right.
you get into your second set again.
So, how do you go into training? I mean, agonist muscle and antagonist muscle on the same day, or like you are doing tricep today, or bicep in the same day, or in different day, or how do you go about combining different muscle groups?
Okay. So when I am on my gaining, I go for compound where I deadlift.
Okay.
A day where I just go and do deadlift.
Absolutely.
Very second day, I go and throw my legs, where I work out for my legs, and for my legs I like work out twice a week, where I take a quads for 1 day and I take my hamstring part on the other day.
Other day, not combined.
Yeah. Not combined, because you can't break those muscles. Those muscles are the strongest muscles of your body, and because
Absolutely.
it works against the gravity, so they are the strongest one. For you to break them, the fibers, for you to get into hypertrophy, you really need to work up in a part. You can't break both the muscles in a day. You can't utilize that energy in yourself when you're on diet.
Absolutely.
And then for my shoulder, I keep 1 day, and my bicep, tricep, I keep 1 day, and my back and bicep I do when I'm on gaining as well on my shredding, because I don't change that system. Abs, my calves, and my tricep. These are my short muscles, which I train very alternatively every day, whichever set I am doing. With that, when I have a time, 15-20 minutes, 1 day like it's Monday, I'll train my calf and I'll leave it. Very second day I'll just train my tricep with my other sets. Like if I have a leg day today, with that, along with that, I'll take 15-20 minutes and I'll train my tricep and I'll leave it, because these are very uh, small muscles, which are very important, because when you do a leg workout, you're already exhausted with burning your hamstrings and your glutes. So you do an unjustification to your calf. So what I do is, I always, my coach from Australia, Andrew, what we did was we changed the plan of not doing calf on the leg day. We used to
Okay.
inculcate
Okay.
it in some other day where I am fresh enough to hit the calf. So that's how I do, and I do my abs very alternate day, and that's all what we do.
Very nice, ma'am. So, ma'am, these are the important, like you are saying, regarding your gain up phase, where you want to increase the bulk of the muscle, and in the shedding phase, where you want the different, distinct anatomy of the muscle. I mean, it should be distinct. That's the beauty should sculpture should come out in the shredding part. So, what are the different, supplement which, like, for example, you have also talked regarding a different supplement. Like, for example, creatine is very common supplement, and arginines also people are taking. Branch in the amino acid, the people are taking like beta hydroxy, beta HMB. The people are also taking. The different people are taking then nitric oxide. I mean. Uh, uh, supplement and all that stuff. So how do you feel? What is the importance of the different supplement in different phases of your training? I mean, from your personal
To be
experience.
very frankly, I won Australian Championship without having pre-workout and post-workout. I,
Oh.
I I feel nauseatic with these kinds of supplements when I'm on floor. I don't take my pre-workouts. Who all knows me, when I'm on floor, I never take pre-workout. I just have a chill water. That's enough for me, because you don't need to work out for 1 hour. You just need to, for 2 to 3 hours. You just need to work out for 45 to 1 hour, and that time you don't need to give lot of caffeine to you. That doesn't make it. So getting a pre-workout doesn't just. So just a moment, I'll get back to you. Yeah.
No problem.
So I ideally don't use that, and
Okay.
yeah. It does give you, when you are a beginner and you are not motivated much, because normally what happens is defaulters are very much when you start a gym, you become a defaulter in a month or so, and
Absolutely.
because you don't see the result, and we feel like, "Arey, I'm doing it since a month, and why I'm not getting into it, and I'm not able to do it." For these people, yes, that's always beneficiary. Like, you feel like, okay, you feel energetic on floor, you don't feel fatigued, and you want to get more and more continuation to your gym. Because normally what happens, first 3 months of a gym are major defaulters, where you join and within of 3 months you leave it. So for pre-workout, yes, when you do your long muscles, like your legs, your back, that's the time where you really need a lot of energy on the floor. So that is the time. But I will never prefer to have a pre-workout when I'm doing my shoulders, when I'm doing my abs, when I'm doing my triceps. That really doesn't give you that much of efficient. You don't need that efficient amount of caffeine to get stimulated when you're on floor, when you're hitting your small muscle.
That's right. That's right. I mean, it is a individual choice, right? I mean, which So I mean, what is your favorite? I mean, you said that you have not used anything, but from
I
your
don't use.
experience.
I don't say that you should not use, but I don't use because I don't like the taste. I'm already onto a bland diet, and I'm already on having a lot of salads, and in that
Yeah.
those repetitively taste of same
Mhm.
pre-workout every day doesn't suit me. I don't. It's not my type. I don't like it. Instead of that, I would hit up black coffee and then have a chilled water on floor.
Okay, that's right. Yes, sir. So, madam, your view on protein supplement. I mean, protein. How much protein supplement has should be taken? Like, for example, whey protein should be taken. People they used to combine, and the casein protein they used to take, before the sleep, and whey protein just after workout and all that stuff. And the general people are also there who are afraid that why you are taking so much protein. I mean, it will be harmful to your kidney. They confuse, steroid with the protein. Because and they tends to correlate, I mean, recent different type of the different, what you call in the gym, along with a high intake of the protein and all that stuff. So what do you view regarding the intake of the protein, and what type of supplement you like, and you generally use in your practice, man?
Protein, you can just have one scoop of a protein a day. That will really not be toxic to your kidney and your body, and you don't won't damage your body as well. And that too when you're done with your workout. That's the time you should have it, because that's the time when you need to go into a quick recovery. See, we all go to a gym in the morning, or we go into the afternoon. Most of them need to work after they do their workout. Like a person like me who hits the gym at 5 o'clock needs an entire day to start with. So when I go, I just can't go home and just prepare my meal and then have it. So at that time, post workout, getting into quick recovery, a protein shake is always a good option. You know because
Absolutely,
we
absolutely.
all major of them who goes into gym are a working people. So that time is important. But after rest of the day, you should make your own meals, and you should have your solid protein other than getting into protein shake and getting into protein bars and all that. That will not help you, give you a healthy lifestyle. And anything, see, anything. If you tell me now that this is not harmful and this is very good, ऐसा कुछ नहीं है. हमारे पास कोई अमृत नहीं है. वी आर नॉट इन एरा कि हमारे पास बहुत प्योर चीज
Absolutely,
है. कोई भी चीज प्योर नहीं है. इसलिए
absolutely.
कोई भी चीजें इनकलकट करने से पहले यू हैव टू अंडरस्टैंड द क्वांटिटी व्हाट यू आर टेकिंग. यू कांट टेक अ ह्यूज क्वांटिटी एंड देन से कि अरे इन्होंने ये तो आर्नोल्ड ने बताया था कि प्रोटीन 5 बार लेना है और कुछ नहीं होगा किडनी पे. ऐसा नहीं होगा ना. हर हर चीज अगर आप लिमिट में लोगे, so it will not affect your body until unless you cross the limit of doing it.
That's right. That's right. That means supplement should be taken as a supplement, not as a
Yes,
main nutrition.
of course,
So
of course.
yeah, yes, ma'am. Bodybuilding, as you have already told, its majority is because of majority is nutrition only. So how do you manage your nutrition? घर में खाना मतलब बनाना कैसे आप कैसे करते हो आपके practice
we
में? How do
we
you do?
prepare a meal in the morning only and we carry it. That is as simple as that.
हम्म
कुछ अलग फंडा नहीं है. बस खाना बनाना है और सुबह लेके जाना है. Whenever you carry, you go to the hospital, you go to the gym, you just carry your food.
That's right. That's right, ma'am. So, ma'am, recently in our society, because our society is mainly of sports medicine doctors and sports science, the people are also there, and we are doing different campaign also. I mean, recently we have just concluded our first conference also. In that conference, many like recent technique we have already talked regarding your blood flow restriction training, where blood flow is being restricted, and bodybuilding, all this stuff is there, and we are planning to incorporate or in the future also different. So what do you expect from us as a society? I mean, how should we do to reach more scientific stuff, collaborate with you and all the athlete, and how we should go ahead so that I mean, many of the bodybuilding they have been taken as a they have been seen from a negative impression also. So, I mean, how do you, how we should do, and collaboratively, what work we should do in order to create a positive environment, more
Uh,
useful?
It's very and very simple. If you ask me, how can you inculcate certain thing in a society? My only answer is, instead of writing a book, instead of printing an article, go and demonstrate yourself to public.
Absolutely. Wow.
क्योंकि
That's
हम
amazing.
हमारे यहाँ पे जहाँ हम रह रहे हैं, हमारे पास सिर्फ एजुकेटेड क्लास नहीं है, हमारे पास एजुकेटेड और अनएजुकेटेड क्लासेस हैं जिनको सब करना है।
बिल्कुल
एक एजुकेटेड लड़के को भी बॉडी बिल्डिंग करना है और एक अनएजुकेटेड लड़के को भी बॉडी बिल्डिंग करनी है।
बिल्कुल,
तो
एब्सोल्युटली।
इसलिए मेरा यही कहना है कि इंस्टेड ऑफ आप आर्टिकल्स दो जो उनको समझ नहीं आए, आप डेमोन्स्ट्रेट कर दो, जाके आप सोसाइटीज में यू मेक अ डेमो दैट गिव्स अ मोर इम्पैक्ट, क्योंकि उनको समझ में तो आ रहा है कि आप क्या कर रहे हो, आप क्यों करना चाहते हो और उसमें से उसे क्या एडवांटेज मिलेगा। ये मैसेज उन तक पहुंचना ज्यादा इम्पोर्टेंट है, तभी तो वो उसको इनकलकेट करेंगे। अभी मैं एक 10,000 रुपीज खर्च करके एक बहुत अच्छा प्यारा आर्टिकल बना दूंगी और मैं सारे जिम में लगा दूंगी, आधे से ज्यादा ट्रेनर्स को तो समझ में नहीं आएगा कि मैंने उसमें लिखा क्या है, उसका एडवांटेज क्या है। नोबडी विल एंजॉय। इट इज वेरी इज एज सिंपल जैसे सीपीआर है, दैट इज कार्डियोपल्मोनरी रिससिटेशन। You every gym, every hospital is supposed to put the poster of it. But
बिल्कुल।
until unless I go and see the poster, I am not going to understand what am I supposed to do until unless you come and demo me what is CPR. So if you are telling the blood restriction, you are doing a research, you did a beautiful outcome of it, and you see that there is a lot of advantage with it. It will be very difficult for you to go world. I mean, like to a lot of population unless you demo that. You make a video of it. You get a team which goes to a gym which covers a local area and make them understand what is that. Because this training I have done, and I must say, it is really something another level of training. I did it when I was in Sydney. I did it with some of the bodybuilders there who were professional athletes, and they told me about this, and I really did it for my legs workout, and it was another level. But then you should only thing is I will tell you is demonstration is the only way you can be to more people.
Practicality is more important. Demonstration has to be. The theory is not so useful. It has to be on the ground. That's right. That's right. Absolutely right, ma'am. So, madam, regarding all the this thing, and I mean, recent, many of the gym trainers, they don't have, like you have already spoken regarding CPR and all that stuff. So we generally see that because those people who are joining the gym, they are already not healthy. I mean, majority are obese, majority have joined because of that only in order to. So after that, if an untrained trainer will go and prescribe something, if something wrong happen, then it will be a problem. So how do you see this CPR and all the emergency important point? I mean, how do you see are they being implemented at India now, or there is a room for improvement? And if there is a room of improvement, what do you suggest? I mean, how it should be done?
It should be done only in a way that every gym should inculcate CPR trainings. See, मैं इतना ही बताना चाहूंगी कि एक साधारण घर से जब बच्चा ट्रेनर बनने आता है, वो अपनी फैमिली की रिस्पॉन्सिबिलिटी लेने आता है। अब उसको पता नहीं होता है कि जिम में आने के बाद सीपीआर होता क्या है। और वो सीपीआर सीखने आया ही नहीं है, वो अपने परिवार के लिए सैलरी लेने आया है।
बिल्कुल, दैट्स राइट।
जैसे आप बड़े-बड़े जिम्स में देखते हो, यू गेट अ सर्टिफाइड ट्रेनर्स, वो उनके करिकुलम में सीपीआर है। बट अगर मैं उस कम्पिटिटिव ट्रेनर के साथ एक लोकल इंसान जो अपनी रिस्पॉन्सिबिलिटीज पूरी करने के लिए आया, अगर मैं उसको बोलूं कि आपको सीपीआर नहीं आता है, देन आई एम बायस्ड टू इट, बिकॉज उसको कभी अपॉर्चुनिटी मिली ही नहीं है सीपीआर
मिली
उसे नहीं है, तो वो आपको सोसाइटी को हेल्प कैसे कर पाएगा? जब वो अपनी उससे जब अपॉर्चुनिटी मिलेगी सीखने की, तभी तो वो अपना ज्ञान बांट पाएगा। एंड दैट इज व्हाट आई थिंक एवरी जिम, एटलीस्ट even every local gym has to be included into that कि आप CPR demonstrations तो एटलीस्ट करो, हर महीने में नहीं, ये नहीं है कि हर दिन में करो, महीने में एक बार, 2 महीने में एक बार आप अपना नॉलेज को ये करो। हार्डली इट टेक्स 10 minutes or half an hour it takes of your life, जहाँ पे इस महीने में डेमोन्स्ट्रेट करवा दिया एज अ जिम ओनर, यू टेक अ रिस्पॉन्सिबिलिटी कि आधे घंटे तुम लोग सब बैठ के एक बार CPR सीख लो। इट माइट सेव एनीवन's life, you never know.
Absolutely.
So only I think when you give a signature to register a gym, only thing is you need to inculcate in that is CPR every month's training in that.
That's right. The CPR and all the emergency has to be, ideally it has to be implemented, and it should be done, because exercise is basically a physiological stress. So anything can happen. That's why we have to be ready. I mean, if something goes wrong, then we have to be ready. And regarding, ma'am, your career has been long. So I mean, you must have witnessed some type of injury or nothing. I mean, up to now, everything okay? Or if you have suffered a kind of injury, so would you want to talk a little bit about that? I mean, regarding your training, injury or something like
Really
that?
not, really not. As I said, I'm a doctor. I'm a very safe player.
Very
So
nice.
I have never been through anything.
Oh, wow.
And that's why I always write on my post that there is a desire to inspire. I get so many messages regarding everything from medical field to gym related. I take a time out of my day where I really give them a time to make them understand the right thing.
Absolutely.
I even if it is educated, uneducated, is poor, is rich, doesn't matter to me. For me, matter is how I'm sharing my knowledge. If I have a knowledge, I need to share it. I'm not going to take it with me. That's a basic funda. So what I do is whoever has a problem that I have this issue, I have this issue, I just whole day, I just take a time out, some in a time where I just go with all the important messages and I just make them understand. There are certain people who sends me their cancer reports, who sends me their blood reports and everything that this is what, this is what, this is, and I take a time to make them understand. And I think as an athlete, as a doctor, it's ethically for me to, share my knowledge to the people.
Absolutely. Absolutely. That's right. That's fantastic. So that's a very nice. So what is your future plan regarding, what are your future plan? What do you want to take about?
I'll be the same as a doctor and athlete. I will be competing in future as well, and I'll be taking care of my patient as well, and I'll get more and more babies through my IVF and delivering them. So,
Excellent. Excellent, ma'am. So I think we have been around 1:30 hours. So I
yes,
will
there is
request.
one more thing I would be included in
Please.
that. When I was in Australia, when I won, I was the only Indian in the auditorium, and there was
Oh,
no
wow.
Indian. Everybody
Oh,
was
wow.
foreign.
Hmm.
So there was a production house who came to me later on. That's Dr. Sami Production.
Okay.
They approached me saying that we have seen Indian women always either in a house or either limited to their career because of their kids and their husband responsibilities. But when
Absolutely.
you break these kinds of stereotypes, when you're out of the box,
Hmm.
entire world needs to know this now that Indian women are not only for the kitchen and the office work and for kids.
Absolutely. Absolutely.
They
Absolutely.
approached to me and they said that we need to make a biopic on this, and
Oh,
we will
wow.
release it onto international film festival where we will depict an Indian woman who
Oh,
is
wow.
from Bombay, who is a mother of two, has been a doctor, because that time there was a COVID scenario, even we were overloaded with the work, and in that she wins a Australian championship, which is
Hmm.
something very out of which we can think of, and that's how we have made a biopic on that, which will be releasing soon now. And if I get a copyright to release, I'll definitely release it on YouTube.
Hmm. Okay. So there are a few questions. I mean, we will like to have the questions from the audience also. Like one question on YouTube, one IPS Cholaji has asked that doing yoga and light exercise, but not able to reduce weight as desired. Please give some suggestion. I am a diabetic. So yeah.
Diabetes always has a problem of reducing weight because your carb not allow you to do that. Your carb storage will be more. So for you, you need to restrict your carb diet. That's the only thing you can do to reduce your side. Yoga is all beautifully what you're doing. Hit you're doing. It's all good what you're doing. Only need is to cut off your carb.
Mhm.
As I said, after six, she has to completely shut down her carb, and then she sees all the changes of what desired weight reduction she wants.
Mhm. Okay, very nice. So one questions from Bipin Goyal ji. My wife is 56 years old. Gynecologist has put on, and she's a gynecologist, has put on more than 15 kg weight. Non-diabetic, normothyroid, now has developed hypertension, has undergone LSCH. Please advise to lose weight. This is
Okay.
from Bipin Goyal ji.
Okay. So, Goel ji, it will not be justified if I just give you a minute of advice. You will really need a counseling to understand that there are a lot of things which you have to understand in your wife's case. So I would be happy if you connect me on my Insta ID of Dr. Maya Rathod, or you mail me about all her reports in drmayarathod@gmail.com. I will definitely suggest you a better way to come and reduce her weight. You know.
Excellent.
I don't
Well,
want to be vague saying, okay, do this and your weight reduces. No, it will really take a time to discuss, and there is no time right now to discuss about it. But I'll
absolutely,
definitely
absolutely.
answer you on my side.
So Bipin Goyal ji, please take Madam. We will also post her the email and all details, and then we will post your questions to her. And some questions from Dr. Siddharth. Dr. Siddharth is our General Secretary. If Dr. Siddharth is present, you can directly speak. Dr. Siddharth, I think he is not there. So Dr. Siddharth has asked some questions like, how much sleep do you plan during training and competition period? How much sleep?
Yes, it is 6 to 8 hours, but for me, it was never that. To be very frank, being when I was in Australia, we have to do all our household work all together. We don't have servants, helping hands, and everything. So for me, 4 hours was enough, which I did that. But ideally,
Okay.
you should have 6 to 8 hours sleep. But when you ask me, I don't sleep for that much hours because I think I wasted my time then.
You have not slept yet. You have not, any kind of the injury also. That's amazing. Yes. And the other question here is, what supplement do you take as addition? If what supplement? I think we have already talked regarding a supplement also. For a brief, you can brief ma'am to him. What supplement do you
I
take as
do take
addition?
vitamin C for my recovery.
Mhm.
I do take protein shakes in the morning after my workout because I don't have a time to prepare it early in the morning because my kids, I need to wrap up them and school and everything and making my meals and then rushing to hospitals, different hospitals. So for me, I do take protein shake 1 scoop a day, not more than that. Even if I'm hungry, I don't take protein shakes, of course.
Mhm.
Then I take vitamin C for my recovery. I take omega 3 and
Mhm.
I take multivitamins. And
Okay.
when I am on my like menses or when I'm bleeding heavily, I do
Mhm.
take my iron as well.
Iron.
So
Mhm.
these are the only supplements which I inculcate into my training daily.
Mm-hmm. Okay, ma'am. So one more questions, ma'am, regarding like you have to talk about your menstrual cycle. One concept is coming up that do menstrual cycle really affect the women's performance? I mean, how they? I mean, especially regarding to your sport. I mean, what do you
No,
feel
it
regarding
doesn't.
this?
It doesn't. I have always told women, I have always got these kinds of patients who are super active in Sydney and they train a lot. They are super healthy. They always wants to be fit. I always have a question that do I need to train during my menses? Yeah, it's absolutely fine and absolutely safe to be, working out during your menses.
Hmm.
It
And many of
physiologically
the
doesn't change anything. It
Mhm.
physiologically doesn't change anything in your body.
Yes, ma'am. And many of the athletes have also come asking to even to postpone their menstruation so that it may coincide with some of the competition and all these things. So what
No,
do
you
you
don't need
feel
to
regarding this?
actually. You don't need to actually. It doesn't affect your. It might affect you wearing your attire on competition day, but physiologically it will really not affect you. No.
Mhm. Okay. And one more question: if you could give an advice to a young woman bodybuilder, what would be the one advice which you want to give her?
Can I beg you to for repeating your
Yeah, yeah,
question?
yeah. If you could give an advice to a young woman bodybuilder, what would be one advice you want to give her? So, if you want to give, one advice, one useful advice to a young bodybuilder.
I would say that be an inspiration for your upcoming generation.
Hmm.
That's the only thing I would say. I would love
Excellent.
to be an inspiration for my daughter.
Absolutely, ma'am. Absolutely. That's right. We have to spread we have to spread the positive message. I mean, the fitness, all the things which we have done, it's not only for our health but also for all the society. For everyone has to inspire and all. So with this, I will request the other participants who are there to please directly unmute themselves and talk ask any kind of question to madam also, like Dr. Kiran Kulkarni, you dare? You want to talk with madam? Dr. Kiran?
Yeah, I am there. I was just listening to her, entered very late, maybe 15 minutes back. I'm extremely sorry because I was traveling for almost 40 hours back from Mongolia. Just today afternoon I came.
Okay.
So it was just, the questionnaire session I was there in. Thank you, ma'am. Your inspiration actually, because at least a lot of we as medical doctors do not, because we are never taught about exercise in our medical college, not at all in our post-graduation days. And at least, women of steel like you will definitely inspire more women doctors to take up exercise. Thank you, ma'am. Thank you very much.
For that. Thank you so much for that. I remember post-graduation was like getting trained for your depression.
Absolutely.
How can one not be depressed by getting so much of stress?
Because it is always, we being into sports and into the sports medicine, this thing, we advise women, like they need to do exercise, but immediately they say, if we start getting muscles, so this is always a question mark. And I always tell them, even years of men training in the gyms won't get that sort of muscles. If you do very simple exercises where you are lifting 2 or 3 kgs, if that will bring muscle, then everybody should be a bodybuilder who is walking around.
Yeah, true.
So this deep thing from our brain should go up. I don't know.
No, you won't develop muscle unless you go on a progressive overload. You will not. You will struggle for a year also. You will not develop a muscles unless you do a progressive overload. You are absolutely right on it. Then if this happens, then every other doctor will be a bodybuilder then.
Very nice.
Yeah, I think, ma'am, like another just a question, like how is the thing, in Australia, like in the medical college subjects in Australia, are they putting stress on exercise as a, what you call, as control of disease?
Yes. The first approach
medicines are not going to replace it. Exercise as control of disease.
Yes. The first approach they give to many of the diseases is the lifestyle change and inculcating exercise. When they find that it is when it is on a category of mild, they will always try to change your lifestyle and give you a time frame to, if you change your lifestyle and see the impact of that exercise and lifestyle changes on your disease. And once they find that it is all curable, they will ask you continuing doing that. If you are on a moderate or high, then they start you with the medication. But I've always seen them to be a non-medical approach first, other than being a medical approach.
Thank you, thank you. Nice.
Absolutely. Dr. Ken, you there? Dr. Ken. Sir, you there? Dr. Ken John? I think, let me check. Dr. Ken? I think.
Yeah, I think, can you hear me?
Yeah, please, sir.
Yeah, I have no questions.
Okay.
Was just enjoying the talk.
Okay, very nice. Very nice.
Dr. Kulkarni, and I would just say that it's with Dr. Rathod. What she said is something that I've been advocating for the last many years since I have started sports medicine, basically because the advantage of being a sports person is, which ma'am said, you need to demo. No matter how much, this is one I'll add on to this one thing. I always tell people that, right now I may not be as fit as I was because of a lack of time, and then you're aging up also, but maybe a few years back, if there's anything I want to teach the athlete, especially, I don't just do the coaching because I just help with the coaching or anything. Being a doctor, I like to give back. Tennis has given me a lot. I play tennis. So tennis has given me a lot. Same with football. So if you can go in and show the athlete, like for example, I want to do control training. Say, let's take football. I want to do control training for a player who's injured. Now I want to put him back into field of play. You may give all the theory in the world you want. You may give the FIFA 11, FIFA 15. You can give Barun 25. You know, can give Dr. Kenjong 14 rules. It doesn't really matter. If you can get on the ground and show them how it's done. If you can do that, nothing like it. Nothing like it. Same is with tennis also. Like, you know, I feel that I'm able to solve a lot of problems because I play the sport personally. So it's not the theory or biomechanics or anything. You know that the action is wrong. You know the technique is wrong. In a coming point of time like bodybuilding, if you know the form is not correct, if you're lifting weights, if the form is not correct, you are never going to get the desired weight, the results. Even if you get the desired results, you may get injured if the correct form, correct technique is applied. It's very rare, very, very rare that you may have special people, you know, with special talent, with the wrong technique and still go ahead. But that's one of those very rare, very rare. So that's why I agree with her. She says, ki no matter how much in theory kar lo, how much PhD kar lo, how much research papers you publish, ultimately it has to go down to the people and the roots. And you can have people from uneducated people, which I picked up what she said, and to very highly educated people. Yes, we need research. We need research, we need everything. But let me tell you, I even tell especially the physios and doctors, or especially the physios, you are telling them to do correct push-up, correct squat. If you yourself are not able to demo, how will you tell them what is correct by watching your YouTube video? But what you do live there, which you can demonstrate. Same as with the CPR, no matter how much theory classes you take, you should have those demos, you live, make it fun. I'm sure these are the things that I picked up, which I hope everybody who's listening should pick this up. Whether you're a doctor, you're an educationist, if you can physically demonstrate, nothing like it. But yes, like I play tennis, I play football, same ma'am's a bodybuilder, but we cannot kick like Barun, right? So now I want somebody to show a kick. We get an expert over there on the ground to demo the stuff. So it's not necessary that a doctor or the physio or the scientist has to do it, but they take the right people, you know, who can influence and show the right things. This is what she meant also. She didn't mean that all of doctors over here, like Dr. Kiran can do somersaults, you and I cannot. Right. So I think we take the right people also to help us. You do the theory, but help the right people to demo, to explain physically, practically, and I think your whatever intention that you have will be more accurate and will be more beneficial to the people. I think I'll stop here.
Absolutely, sir.
It was a great talk, Dr. Rathod. It was nice.
I would like to add into it. We are into a world where we all have to take initiative. We can't be reliable on one person and expect the change of the world. Like we all are doctors, we all are knowledgeable. We all need to share our knowledge with these people and let them get safe from this misguiding concepts. Like I'll tell you, I'm not a person of a verbal. When I went to a Baruch for my IVF thesis, it's a Gujarat. There's a place called Baruch. It's a very small place, not even 10 kilometers area. I went to the gym there and I could find that there are so many, all the trainers are uncertified and they're training. I myself took an initiative and said this owner that can I teach them CPR on any Sunday you tell me? And he was like, why? I mean, like I said, that's very important. You get all kind of disease people here. You get all old, all ages. You never know someone collapses on your floor. So it's very important. And that's how we all also as a doctor has to take a responsibility. Like out of the box, we have to go whichever gym we go. We just go and tell the owner that just give us half an hour and we will teach your trainers and CPR. We never know which life we are saving directly, indirectly of anyone's, you know. So that's all what I think my perceptions all about is.
Absolutely, ma'am. And we being the sports medicine doctor, I mean, I think 80 to 90% of the doctors who are coming in this field, sports medicine, they are player itself, player or, you know, related with some type of physical activity. So the point well taken from our society also in any kind of the future event, in conference or something, if we do, we will always have this practical part and we will give more importance to the practical rather than theoretical, all that stuff. So we are planning to launch different, you know, workshop, also small workshop in collaboration with different society from Singapore and all that stuff regarding basic, you know, strength training or the training for the hypertrophy, what should be the recovery, what should be the nutrition and all that stuff, technical stuff. And you are also most invited, ma'am. And I will request you to please also take up our membership so that, you know, I mean, a future collaboration, more practically oriented collaboration.
I'm always on my toe to practical things and share my knowledge.
Absolutely.
I always have a desire to inspire people all around me. You tell me, and I'm all on my toe to come and help you all guys.
Wow.
I work for sex workers. I work with their NGOs. I work with the kids. I work with the blind schools where I go and take their health checkup, the lead girls who have a blind schools. I do multiple things which I even don't want to show off to people because I think that is for my thing. That is my life journey where I want to spread my knowledge to people. And I don't want to share it publicly. And that's how I think we all doctors are somewhere a good heart people where we need to share our knowledge with everyone.
Amazing. So the other two, the Prasanji and Sushma Sharma ji, if you have anything, you can unmute yourself and you can speak directly. And I think there is no comment in the YouTube also. So Prasanji and Sushma Sharma, if you have anything, you can unmute yourself and speak directly. Prasanji, Sushma Sharma. Okay, no problem. So, ma'am, thank you very much. I think it's 1 hour 45 minutes already. I mean, time kaise pass ho, time kaise nikal gaya, kuch pata nahi chala. We learned lots of things from you, and we, as you have said, inspiration, excellent. I mean, we inspired to do more practically. It has to be, the work has to be done on ground. And we thank you very much from our society. Our society is new society, but still we have a long way to go, and with support of you yourself and the inspiration which we get from you in the near future also, we want to do something great. And thank you very much, ma'am.
Thank you so much for giving me this platform, and stay blessed, and all the best for all your future ventures.
Thank you, madam. Thank you, madam. Okay, thank you. Okay, ma'am. Bye.
Thank you, ma'am.